Welcome to our training on crystalline silica awareness. Why are you taking this course? Let's find out. Read each statement and decide if it's true or false. It's okay if you don't know, we'll explain the correct answers. Pretty much any activity involving dirt or rocks can expose you to crystalline silica. True or false? Crystalline silica can make you really sick. True or false? There's nothing you can do to prevent crystalline silica exposure. By the end of this course, you'll be able to recall what crystalline silica is, recognize materials and operations in which crystalline silica may be present, recognize the health effects of crystalline silica exposure, identify ways to protect yourself when working with crystalline silica, and know appropriate first aid measures for crystalline silica exposures. Silica is an abundant mineral that makes up the Earth's crust. That means it's pretty much everywhere. This course is about silica in its crystalline form. Crystalline silica is a basic component of soil, sand, granite, quartz, and many other minerals. Let's make sure you understand what crystalline silica is. Click the materials that are likely to contain crystalline silica. When crystalline silica is crushed into small enough particles, such as grains of sand or smaller, it can become airborne. When that happens, you can breathe it into your lungs or get it in your eyes. Crystalline silica that you can breathe in is called respirable crystalline silica. You already know that crystalline silica is in most dirt, rocks, and minerals. Any work that involves cutting, sawing, drilling, or crushing these materials can result in respirable crystalline silica. Activities such as cutting a granite countertop, core drilling through a concrete floor, and even sweeping a street can stir up crystalline silica into the air. Let's make sure you can recognize locations and operations where respirable crystalline silica may be present. Drag the activities that might expose workers to respirable crystalline silica onto the image. Let's try another activity. Look at the image and select the best answer. Could this worker be exposed to unsafe levels of silica dust? As we mentioned earlier, you can be exposed to crystalline silica when it gets in your eyes, making them irritated. You can also inhale respirable crystalline silica. The health effects of inhaling it are much more severe and can include kidney disease, chronic obstructive pulmonary disease or COPD, lung cancer, or silicosis. You may have heard of most of these, but what exactly is silicosis? Silicosis is a respiratory disease, which means it affects your lungs and makes it hard to breathe. There is no specific treatment for silicosis. There's no cure for it either. It can kill you, so take it seriously. There are 3 types of silicosis. Chronic silicosis occurs after 10 or more years of exposure to relatively low concentrations of crystalline silica. In other words, it occurs after being exposed to a little over a long time. Accelerated silicosis develops 5 to 10 years after the first exposure. Finally, acute silicosis happens if you're exposed to a high concentration. In other words, a lot of respirable crystalline silica. You may start to notice symptoms from a few weeks to 5 years after you're exposed. You should also know that people with silicosis are at high risk for developing the active form of tuberculosis, or TB. Silica exposures and related ailments can transform a latent and asymptomatic TB infection into the dangerous symptomatic disease form of TB. Silicosis has specific symptoms that you need to be aware of. If you experience any of these symptoms and believe that you've been exposed, talk to your doctor immediately. The symptoms of silicosis are shortness of breath, possible fever, fatigue, loss of appetite, chest pain, dry, non-productive coughing, and respiratory failure, which may eventually lead to death. As you can imagine, many of these symptoms may not seem severe. They can be caused by a number of other things, such as colds, the flu, or allergies. That's why you need to take charge of your own health. If you believe you've been exposed to crystalline silica and notice any of these symptoms, see your doctor. It's better to be safe than sorry. Before we continue, let's make sure you can recognize the health effects of crystalline silica exposure. Drag the health effects of inhaling crystalline silica on. Your employer's first line of defense against crystalline silica exposures are engineering controls that prevent workers from being exposed. Examples of these controls include choosing a material that doesn't contain crystalline silica, installing and using local exhaust ventilation, using containment methods such as blast cleaning machines and cabinets, and wet sawing or wet drilling silica-containing materials. Once your employer has put as many engineering controls in place as possible, he or she can implement administrative and work practice controls to limit or minimize crystalline silica exposure. For example, your employer can limit worker exposure by excluding non-essential personnel from potential exposure areas and scheduling cutting tasks to occur at times when fewer people will be present. Airflow and the direction of cutting determines where materials will be deposited. Position yourself away from these areas when possible, for instance by moving upwind so dust blows away from you. Crystalline silica can be stirred into the air during cleaning tasks. Employees may be tempted to blow dust from their clothes or from equipment or work surfaces. Avoid the use of compressed air when cleaning because it creates dust clouds. Housekeeping is important though, so sweep after first wetting the area to suppress dust, or use a vacuum system equipped with high-efficiency filters. Following manufacturer's instructions will ensure controls work as intended. Vacuum filters must be changed or cleaned. Collected materials must be emptied. Hoses and nozzles must be positioned properly and maintained free from clogs. Your employer may also require you to take a shower and put on clean clothes before you leave work. This will prevent you from inhaling dust from your clothing or tracking it into your home. Engineering and administrative controls may not be enough. Your last line of defense is personal protective equipment, or PPE. You must wear an appropriate respirator to prevent or minimize crystalline silica inhalation. Talk to your supervisor to make sure you choose the right respirator for your exposure. And to protect your eyes, wear safety glasses. Let's make sure you can identify ways to protect yourself when working with crystalline silica. Read the question and then select the best answer. To protect yourself from inhaling crystalline silica, what PPE do you need to wear? If you get crystalline silica in your eyes, flush them immediately with large amounts of lukewarm water, holding your eyelids open. If irritation persists after washing, seek medical attention. If you breathe in large amounts of crystalline silica dust, move to fresh air at once. Keep warm and at rest. Get medical attention as soon as possible. If someone inhales crystalline silica and stops breathing, perform artificial respiration or CPR. It's important that you follow your site's emergency procedures. For example, in a dangerous situation, you need to call for help and avoid becoming another casualty. You're near the end of the course. Before we conclude, let's make sure you know appropriate first aid measures for crystalline silica exposure. Read each statement and choose the answer that best completes it. If you get crystalline silica dust in your eyes, you should flush them with alcohol, saline solution, soap, or water. If you accidentally inhale a large amount of respirable crystalline silica but are still able to breathe, the first thing you should do is ask someone to perform CPR. Drink a large amount of water. You should now be able to recall what crystalline silica is. Recognize materials and operations in which crystalline silica may be present. Recognize the health effects of crystalline silica exposure. Identify ways to protect yourself when working with crystalline silica. And know appropriate first aid measures for crystalline silica exposures. Once you are back on the job, be aware of crystalline silica danger and stay safe. This concludes this course.